I'm going to demonstrate how you can release tightness and compression caused to the brachial plexus nerve, so the median nerve, the ulnar, and the radial nerve, okay? So there are very easy and simple techniques that you can do at home. And first of all, I'm going to demonstrate them passively, and then Shantelle is going to do them actively herself, basically. Now, what we're going to do, there's two types of techniques here. The first type is going to be the so-called nerve glide. So when you're creating a nerve glide, all you're trying to do, you're trying to create movement along the pathway of the actual nerve. And the second one is called a nerve floss, and the nerve floss is more of a nerve stretch rather than a movement. Okay, so that's an easy way for you to differentiate between these two techniques, because sometimes people mistake and kind of overlap the two techniques, but there is a difference in what each one does. So definitely the first thing you need to do is start with the so-called nerve glide, because it's an easier technique. So from here, I'm going to demonstrate how you can do that. Basically, I'm going to hold on to Chantelle's hand there, and then what I want to do, I essentially want to move her head in the same direction as I'm moving her hand like this, and then repeat the movement. So this is the so-called nerve glide, where what's happening there, this is the origin point of the nerve, and this is the insertion point of the nerve. So these 2 points are moving at the same time. Whereas if I was doing a nerve floss, these 2 points will be moving in separate directions. So if I do this, can you feel a stretch there at all? Along the line? So Shantelle will be able to feel like a quite deep stretch sometimes. If you've got compression and tightness, you're probably going to feel even more of a stretch, which is normal. But if we are doing just a glide, you don't feel as much of a stretch there, right?
It's gentler.
It's like it's definitely a lot more gentler, and it's really good for people who actually have bulging discs or herniations in the cervical spine or the thoracic spine here. If we want to target the radial nerve, what we're going to do is rotate the arm so that you can essentially see the radial nerve, and then I'm going to create the same movements, but this time the arm is facing into the opposite direction. So this is the so-called glide that we've mentioned before. And then if I want to create the floss, Chantelle's head goes the other way and the hand goes in the opposite direction, basically. And when you are doing that actively, you can essentially put a lot more pressure, taking the arm out yourself, and you can really feel a difference, because now you are moving the muscles actively and the nerves are stimulating this movement. This is a really good exercise for releasing tension for the median and the ulnar nerve.